Ochsner Health hospitals rank as the best in Louisiana for overall care and numerous specialties and procedures by the U.S. News and World Report. This year, Ochsner's women's services soared in rankings to number 13 in the nation. In this segment, sponsored by Ochsner Health, Dr. Joseph Biggio is here to talk about this honor. Good morning.
Good morning.
Thank you so much for joining us. 13th in the nation is a big deal for South Louisiana. Tell me more about this honor.
So we were very excited to see this honor, and really what it affirmed for us was the commitment that we've made to working to provide high quality care and compassionate care to the women in this area. And I think what's really great is for patients here to be able to know that they have access to some of the best care in the country when it comes to women's services here locally.
Yeah, I mean, when you talk about access, that's something that, especially when we think about like our rural communities and things like that, access is a big indicator for how well people are going to do. What is Ochsner doing to create more access for people?
So we've really looked at a lot of different ways to improve access to care for patients here in New Orleans and beyond. And we've used a lot of technology and innovation to really drive that access. We've incorporated into our obstetric care programs that involve digital health and digital monitoring with remote monitoring of blood pressures at home, where a pregnant patient takes her blood pressures at home and it automatically uploads into her electronic health record and can be viewed by the care team. And
that's amazing, because I'm just thinking about, you know, having to go to the doctor just to get your blood pressure checked. People may not be able to make that trip all the time.
Yeah, I mean, we've really seen that it makes care much more convenient for patients in New Orleans who may have access to be able to travel, but also especially remotely and in our rural areas where patients travel for an hour just to get to the doctor. And especially like for postpartum blood pressure checks, and when they have a baby that they're trying to care for, they don't care for themselves.
Right.
But the other thing that we've really incorporated, and a lot of this was driven initially by some of the changes that had to be made with COVID, is really incorporated telemedicine and e-visits and virtual care into providing care in the ways that patients want to experience it, at times that are far more convenient for them when they're not having to take off work, where they're not having to travel. And we've really seen tremendous growth in those areas.
Would you say that the incorporation of technology and some of these digital tactics is one of the biggest drivers of your success? I mean, to be 13th in the country is a big deal.
I think that I would say there's a couple things that have really driven the success. I think technology and innovation have been a huge part of it. I think the other huge part of it has really been the collaboration and multidisciplinary care that we're able to put together. Because whether it's in our Menopause and Women's Wellness Center that really brings together experts in gynecologic care, as well as those who address other areas of life, or excuse me, other areas that need addressing at that stage in life. Cardiology, many women are worried about weight gain and weight management, neurology, mental health, all of those things brought together under one umbrella, and it's that type of collaborative approach for that. Our GYN oncology programs all drive where that's going.
Well, Dr. Biggio, thank you so much. Really exciting for Ochsner. 13th in the nation, right here in New Orleans. Some really great medical care, especially for women. Thank you so much.
Thank you, Shelley.
Appreciate it.